morning. My name is Tracy Trypuc. Welcome to Your Health Matters. Today we join many in the U.S. who are preparing for Mental Illness Awareness Week, MIAW, a national campaign established by Congress in 1990 and held in the first full week of October this year, and it occurs this year in October 5th through the 11th. Mental Illness Awareness Week is a week-long campaign with the goal of reducing stigma and promoting understanding in the community. It also coincides with National Depression Screening Day, which occurs on Thursday, October 9th. So before I introduce my guests, I'd like to share some important information. 1 in 4 adults, approximately 61.5 million Americans, experience mental illness in a given year. Approximately 20% of youth ages 13 to 18 experience severe mental disorders in a given year. For ages 8 to 15, the estimate is 13%. 70% of youth in the juvenile justice systems have at least one mental health condition, and at least 20% live with a severe mental illness. Approximately 60% of adults and almost half of youths age 8 to 15 with mental illness receive no mental health services in the previous year. Serious mental illness costs America $193.2 billion in lost earnings per year. Mood disorders such as depression are the third most common cause of hospitalization in the U.S. for both youth and adults ages 18 to 44. Suicide is the 10th leading cause of death in the U.S., and veterans represent 20% of suicides nationally. Each day, almost 22 veterans die from suicide, almost 1 per hour. And now I would like to introduce my guests. Today in the studio, we have with us Paula Fries. She is the C.O.O. for the Association for Mental Health and Wellness here in Suffolk County, and Rachel Priest, who is the Community Health Educator and Helpline Resource Specialist from the Mental Health Association of Nassau County. I want to thank you both for joining us. This is an important topic, and I appreciate you both coming here today. So, Paula, last year your organization promoted positive dialogue about mental health as it relates to overall wellness. And you also have reached out to more people in the community, other stakeholders as well. So can you tell us a little bit about what's going to be different this year?
Absolutely. Just a little history as to why we took this direction. For 20 years we were holding a conference every day. Not every day, excuse me, one day out of the week in MIA week, and would bring in very well-known people, from actors to sports figures, who would speak personally about their own experience with mental illness and recovery. After doing that for 20 years, we decided the whole purpose of the week is really to bring it to the community at large. So we took a different direction last year, and we partnered with lots of organizations in the community to promote awareness and a dialogue about mental health, and that mental health matters, and to help reduce the prevalence of stigma. And it was an incredible success, and this year we decided to incorporate and partner with our sister agency in Nassau County, the Mental Health Association, in order to make it a bi-county effort at bringing the dialogue to the community where it belongs.
And so, Rachel, before you get a chance to respond, I do want to applaud both agencies for this bi-county effort and for having these events spread out all throughout Nassau and Suffolk County, all of the days of Mental Illness Awareness Week. So would you like to explain how your organization got involved and what you're going to be doing as well?
Sure. Last year we were very lucky that Suffolk County helped us advertise the Nassau County events. So it was really a natural progression for us to work together this year, find out what events were taking place, find out what events we could put on, find out how we could advertise each other's events, and really work together to capture as many people on Long Island for this week.
Okay, so now when we're discussing these events, there is a calendar of events, and that is available on the website. I do have a few that I'd like to address with you, but they can go to what website to get the calendar of events?
Yes, the full calendar is located at www.nccoe.org. miaweek.org, and you'll see everything. It starts on Sunday, October 5th through October 12th, and we have close to 30 events happening within the community from all across different groups and organizations partnering with us to help get the message out and to promote the dialogue.
And can you discuss, you're going to be beginning on Sunday the 5th with the Military and Veterans Family Day?
Yes, the North Shore LIJ Behavioral Health Center located in Bayshore for veterans and military families is kicking off the event with a family day. It's open to the community at large. It's geared towards veterans and their families, but anybody could show up to gain awareness and get information. I'm not sure where it's actually located and happening, but that's a good reason then to visit the website. And again, I can't emphasize enough that it's free and it's open to the public, and that starts on Sunday, October 5th.
And so you have your kickoff event now on Monday. It's
Yes.
a town hall meeting.
Yes.
Want to
Sure.
go ahead
We
and
are
expand on
starting
that?
off on Monday morning, October 6th, at the Huntington Hilton in Melville with a panel presentation and discussion. We're calling it a town hall meeting with some of the leading thinkers and visionaries and to discuss and talk about the state of mental health within the region, the Long Island area. We have Harvey Rosenthal coming from the New York Association for Psychiatric Rehabilitation Services. We have Sheriff Vincent DeMarco to talk about the impact of mental illness in the Suffolk County jail system. We have Commissioner Ann Sullivan coming from the Office of Mental Health, and about 2 or 3 other panelists that I don't remember their names, but it's going to be an incredibly lively discussion. The theme of it is asking the right questions, exploring new solutions. And again, it's to open up and kick off the week and to build a platform for where we move.
Okay. And I just want to take this opportunity to thank Sheriff Vincent DeMarco from Suffolk County for participating in this. I was invited to their open house on Sunday, and they had a really great number of family members come out to be present, but the Sheriff's Office does have a lot of good programs that are public health related. So I'm glad that they're participating in your open house, in your kickoff event. And now, would you like to talk? Your event is going to be on Tuesday in
Yes.
Melville. Is that correct, Rachel?
My open house is actually in Hempstead.
Hempstead.
At our organization. It's
Right.
16 Main Street in Hempstead. We're having an open house called Ask Your Question. Our organization, plus a lot of the other organizations on Long Island for mental health, can be very confusing. People who don't know what the services that are available, how they can access these services, how do you pay for these services, what are these services. So our Ask Your Question is going to feature several different departments from our organization. We're going to have people from our peer department called Consumer Link. We're going to have PROS, which is a day program for personalized recovery-oriented services. We're going to have somebody from our care coordination, formerly known as case management. And we're also going to have myself from information and referral if people are looking for phone numbers, hotlines, anything that they're really interested in. And they can come in. It's a 2-hour. You can drop in, drop out, however you feel comfortable to get the information that you're looking for. And it's also free.
Okay.
So.
And not to bypass any of the
Of
events,
course.
because each one is very important, and you have many on each day. But I would like to fast forward to next Thursday, October 9th, which is National Depression Screening Day. And there is an anonymous screening that people can take, and it is not anonymous at www.helpyourselfhelpothers.org. And when a person takes this screening and say they're doing it because they have a loved one or for themselves, what are the prompts at the end as far as if they do need to receive some kind of mental health services?
Well, usually with such a type of tool that's on the web, it basically is really to help promote awareness that you may need to seek additional discussion and resources in the community with a treatment professional, but it really is to help promote awareness and to say there are resources out there and maybe you need to go to talk to somebody else. It is not considered an actual diagnostic tool, but it really is to help lead people in the right direction, much like getting your blood pressure read or getting your blood sugar tested. This is really to help people understand that this is a very treatable condition and it is something to take serious and to look for further guidance and assistance around. And there is a wealth of information out there.
Yes. And also to add to the online screening tool, during the week, New Health Family Centers, which are a part of NUMC in East Meadow, they will be doing screenings in their family health centers throughout the Freeport, Roosevelt, Uniondale, East Meadow area. And that information can also be found on the website mhanc.org. Which also links back to the Suffolk County calendar of events.
Okay.
Absolutely.
And all of these websites and the hotline numbers will also be shown on the screen either during the show or at the end of the show, just to let you know. So we don't have to keep spelling them all out, but it is very important to get that information out there. I noticed that you have events targeted for youth mental illness, for those in the lesbian, gay, bisexual, transgender community, and families with from domestic violence and faith-based. So you really are covering quite a bit of territory. And how long has it taken you to set up doing this week? I was curious about that.
That's a great question. We actually start planning the events a year in advance. Each year we have a committee that gets together and we begin by brainstorming ideas. Like we start with what may be current in the news, because oftentimes that helps to push a dialogue forward. And then we begin to reach out to our partners. And it's amazing. We have a community or a committee that's made up of all different kinds of people. Again, we bring in people from the community, from the faith-based community, from other organizations, from the medical community, across the board. It isn't just within the mental health domain, because the goal is really to bring it back out into the community at large, into the world where people really live, and to begin to promote awareness and to begin to break down this wall of stigma and promote.
Thank you. That was
that is probably one of the biggest hurdles that we deal with.
That's what I was just going to ask you, because actually I saw something about, stigma and accompanying shame. And Rachel, I'm going to toss to you in just a second, but I wanted to ask Paula. Michael Stoltz was quoted recently in Newsday with regard to the terrible tragedy of Robin Williams, that hopefully as a society we will insist on getting uncomplicated and affordable access to treatment, increased peer support, and a greater understanding and acceptance between mental health and physical health. So if we could just briefly discuss that and then segue back into the stigma part.
Oh,
Parity of services that we were trying to discuss, earlier prior to the show.
Absolutely. Well, for too long, probably for the past 50 or 60 years, we had this incredible split between dealing with medical conditions that involved what we call the head and divorcing it from what was going on with the body. And we are finally coming full circle and looking at the whole person and whole health. You cannot have whole body health without considering what's going on with mental health. So we're looking at the whole person, and we're actually moving back to a world of what we called integrated healthcare, where behavioral healthcare and physical healthcare is not separated. And the beauty of that, again, is addressing it, that moved it forward, was demanding that these conditions be given the same parity in the healthcare world and in the insurance reimbursement world as for physical health. That there was, oftentimes there was this incredible discrimination and separation and rationing of healthcare services. So we are beginning, that has been changed, the ball has been moved forward. We still have many hurdles to overcome between New York State parity, which is in effect for quite a few years, and that was called Timothy's Law. And in addition to that, now we have federal health parity, which has been championed by Patrick Kennedy. So we're at that point, and it is, again, about when you need to have the dialogue about the whole person and bringing that into the primary care setting and beginning to break down those barriers of just asking the right question and looking for solutions will help to have the person understand that this is a whole health condition. And that will go you have to ask and talk and be open to have those discussions with, and that's the only way stigma falls.
Right. And Rachel, so I'm sorry.
I just wanted to bring up that the community forum we're having is actually addressing these directly.
Okay.
So it's definitely something that, you know, people are talking and listening. So
I just wanted to ask you then, could you just discuss for a moment, you know, stigma and how you feel we need to move forward in trying to destigmatize, you know, an illness that is, as you said, you know, we need to think about the whole body. When you keep saying, like, we need to find out what the right questions are, give us some, because you're involved with that.
Yes.
What are some of the questions?
I myself have bipolar disorder plus a bunch of other diagnoses that really don't matter. And I've been dealing with stigma for a very long time now. So I personally know what it's like to go through life with people looking at you and viewing you differently because of an illness or a disorder or whatever name you want to call it. It's the reason I got involved in mental health care, because I know what kind of toll it can take on a person and their family. It's not a one-person issue. It can affect everybody around you. What I do is I work with a group of individuals who also are in recovery from mental illness and go into high schools to work with teenagers. But personally, on my own, I do a lot of writing about mental illness. I do a lot of blogging about it because it's one of those issues that is not going away, and we need to be able to speak about it. There's no shame in having a mental illness. There's no shame in heart disease, so we shouldn't have a difference, and there is one. And I am starting to see people kind of opening their eyes. But events like Mental Illness Awareness Week target everyone who needs to be aware of what's happening.
Yes. First, I really want to appreciate you for sharing your story, and that resonates very well, the stigma that I'm always hearing about. And it seems like it's almost the last frontier, in addition to getting full parity, which, you know, we should be getting, but we know that there are doctors that will only take cash, you know, patients, but it seems between the parity issue in healthcare and stigma, those are the two most important, from me looking at it, are the two most important hurdles to try to overcome. Do you agree? Do you see that there are other things as well?
Well, absolutely. This is a rights issue, and it's also, for many, it's also, it's breaking down the walls around cultural issues also. The more comfortable we become about talking, and I'm not saying, you know, it's about promoting dialogue and talking about the human nature of what each of us experiences. And when people begin to share that, it breaks down so many myths and walls to accessing healthcare and also promoting healing. So moving this dialogue forward is critical. There is a tremendous amount of misinformation out there. There's a tremendous amount of the things that hold people back from seeking health and treatment is because of the aspect of, if I share this, I'll be discriminated against, I will be ostracized, I will be shamed, and you know, we have to address those issues, and we have to take them seriously, but not give up and throw in the cart. It's to take action and to be out there and speak about it.
Okay. Would you like to address that?
I think that, you know, Paula said it perfectly and a lot more professionally than sounding than I could have, but advocacy is such a key issue. whether it's for someone you love or if it's for yourself, if they don't hear our voices, things aren't going to start to change. And I've advocated for myself for a long time, and I see what families are going through as an information or referral specialist when they call me looking for resources and they have such difficulties. So the more voices that are speaking, and the louder that they speak,
yes.
the resources are going to start popping up, slowly probably at first, but they're there and they're going to come forward.
That was going to be actually one of my next questions, is what are some of the resources that are available out there, especially, in times of crisis, either for a family member who sees a loved one in a crisis situation, or for a person, themselves who recognizes that there's a need. And say they might be afraid to go to the doctor because of, the stigma, but there are some anonymous
Absolutely.
Telephone lines.
Yes. Yes. Well, actually, we have a helpline, and the MHA Association in Nassau County, they have a helpline also. Our helpline can be reached at 631-226-3900. And what we do is we help to answer questions that people have. It's anonymous. You call up. You might be seeking a practitioner. You might be seeking information on a local program or benefits issues. We have skilled staff that are there to answer those questions and link you with what's available in the community. And also, if they don't have the answer, I guarantee you, if you're willing to receive a call back, they will take your number and they will get back to you and try to find an answer. So there are resources out there. This is a helpline. There are lots of hotlines for people who are in crisis that they can contact also. And they will also give you that information. But there is a wealth of information out there available on the internet, but sometimes you need someone to talk to help you to figure out what direction to take next.
Okay, we're starting to come close to the end of our show, but there's still a few things that we have time to discuss. Rachel, can you discuss some of the questions and some of the do's and the don'ts when there's a person that you want to try and start a dialogue with someone that you think might be in need of some assistance?
One of the main questions that I've found is people like to say, "What's wrong with you?" Asking somebody what's wrong with them is never a helpful thing. You can ask somebody perhaps, did something happen? You seem to be feeling down. Is there something making you feeling this way? Or really just the basic, would you like to talk? I'm here to listen. No judgment, no really, oh, well, if you think that's bad, listen to what happened to me. No matter what situation, nobody really wants to have a comparison to the person they're having this talk with. This is a heavy topic.
Yes.
And it's a difficult one for a lot of people. So just being able to ask the question, do you need some help? They might not say yes right away, but knowing that you are available to them is really key for them to seek treatment.
Because you've opened that door for possible conversation down the road.
Right.
Because sometimes patients or people who have mental illness also feel shame within their own family, so they don't feel like they can even discuss this matter, with their family.
Absolutely.
So family support is very important, and I know that is one of the events that you have during the week.
If I could add one thing too, there is a tremendous movement going on in the country, spearheaded by Mental Health America, which is our parent agency for each of our mental health associations. That is promoting education in the community called Mental Health First Aid. And the concept behind it is that just like we have first aid or first aid responses if we see somebody in physical distress, this is about understanding and recognizing that you may see mental health distress. And it isn't about being then, the treating person or the diagnostic treating person. It's about recognizing those situations and being able to gear somebody towards getting appropriate care, much like doing CPR in the community, and that's really exciting.
And we're very lucky because both from my organization and your organization,
Yes.
we had two lovely women, Melanie and Alexis, are trained in youth mental health first aid, and they will be
That's
actually holding these the workshop for it on October 10th.
Okay. Okay, so we are running very, very close to being out of time. So, but I do have my final question, and if you could just try to answer it, as briefly as you can. What do you see is the biggest need to assist those with mental illness, and what are the biggest challenges ahead in mental illness awareness and trying to end the stigma?
For me, I think it is about promoting community dialogue and discussion, and that, chipping away at that and making it more natural and putting it in our natural support systems will help to reduce the burden of stigma. And absolutely, we need to be very aggressive on the advocacy side about increasing resources and access to resources in the community. There's still disparity out there, and we need to not be tireless about that and give up the fight.
I very much agree. She and I are very much on the same page with this. What I see as a huge barrier right now is cultural differences are not addressed properly as well as they should be. And there's a huge stigma within the different cultural lines.
Yes.
And that's something that I think needs a lot of focus, because even at the beginning of the show, you said different disparities exist and they need to be addressed.
Right. And maybe we can have you come back for another show to discuss that. But I do know that the numbers in other, ethnic groups are much lower for seeking help than they are for, Caucasian Americans.
Yes.
So, okay, well, thank you both very much. That concludes Your Health Matters for today. Again, I want to thank our guests, Paula Fries, the C.O.O. from the Association for Mental Health and Wellness in Suffolk County, and Rachel Priest from the Community Health Educator and Helpline Resource Specialist from the National Health Association of Nassau County. I applaud the work that both of your organizations are doing, and especially by working on this important issue in a bi-county effort. Thank you both for joining me. Please join Your Health Matters next week to discuss another important topic, domestic violence awareness, with special guest Allie Mintz from Vibes. Thank you, and have a good day.